Looking at the personality dichotomies as Jung described them, if you look at extrovert and introvert, very much misunderstood. Extroverts are not necessarily party animals. Extroverts tend to be people who think out loud. Introverts, on the other hand, tend to think internally. We like to think in terms of rights as a human right. An introvert has a right to peace and quiet, to organize their thoughts. They find too much external noise and verbiage very intrusive, and they can't get their head together. Whereas extroverts very much are out there and need to consider to be a little bit quieter, shall we say, for the benefit of other people. Whereas introverts would benefit from sharing their thoughts, because in a team, if people can't follow your logic of how you've arrived at decisions, then it makes them feel excluded. It's not very teamy, but it can be an effort to do that. When you look now at how we take in information, sensing types like lots of detail. A lot of doctors are, as you would expect, sensing types. They need to be in order to make accurate diagnoses. Most pilots are like that. But intuitive types are very much big picture people. They tend to ask those annoying questions. Why do you do it this way? Why don't you do it that way? They tend to be thinking out of the box, be more creative, but also more challenging. Now, the two together would make a very good team, because you want one who pays attention to detail and one who thinks about the big picture. But if they're not careful, they can drive each other, shall we say, slightly mad. When it comes to how we make decisions, the judgment scale, some people very much based on logic, very much based on analysis. Other people are more people, shall we say. Their judgments are made more on harmony, on not upsetting people, and on keeping the balance. And when you're dealing with patients, of course, you need to consider the effect on people, which is fundamentally what we are. And there's another dichotomy, which is the lifestyle scale. And this is, do you run your personal life and maybe other people's lives by making decisions, by finalizing, by closing off, by regulating? Or do you like to go with the flow? And do you find that change, which I guess is inevitable in both healthcare and in aviation and in general life, how comfortable are you with that? And perceptive types tend to be more adaptable and less stressed by change. I can't say that they necessarily enjoy it, but they find that it's easier to go with it than just to need to close things off and to be regulated. So that kind of sums up the four dichotomies.